it. So we're going to focus really on the top left-hand side here, which is our consumer product, and specifically the rinse. But again, the same principles apply. Using the power and the knowledge of anatomy and physiology to design a product to optimize, knowing where we need to target those positive regions to improve health outcomes, and ultimately also taking into consideration the negative regions that produce the side effects that you want to avoid. And that can only be done by having a platform that provides this targeted delivery system. And that's what we're going to be covering. We've been recognized internationally for what we've done, which is exciting. This is actually the device, right? So this is the first reveal of what this is. I think it's kind of a novel looking device. We're going to get into a little bit more detail as I go through the device. But a few things to note here is that because of the design of the device, and some of you who may have rinsed before, quite frankly, it's historically not been a very pleasant experience, right? I mean, you want to get secrets from ISIS, you waterboard them, right? It's very effective. Nobody likes to feel like they're drowning. And so I think if any of you have rinsed before, any of the other products are going to produce this really horrific drowning sensation because a lot of the fluid is going to the back of the throat. We're going to tell you how we alleviate that. So whether it's a drowning sensation or ear discomfort, those are all the negatives. It actually produces nothing positive, and it adversely affects compliance from a treatment standpoint, which again, very problematic. Because we've eliminated all that, completely eliminated, and we've focused on where in the nasal environment you want to deliver that rinse to optimize the experience and optimize the health outcomes. And the overall rinsing effectiveness is it's both gentle and effective. And we've actually had quite a few people surprisingly say, I don't know how you've done this, but it's so gentle yet so effective. It's actually perplexing to some people. We actually have clinical data, and I'll go into a slide in a minute, where we've actually shown, we've identified those positive regions of where you should rinse. And what we found is our device, when we matched against the industry leader, I'm not going to name them, but the industry leader, and our device has been shown 10 times more effective. I mean, that's a big deal. You have a product that's twice as good. That's pretty rare. This is literally 1,000% more effective. So that's actually a big deal. If you look at the bottom, what is it for? It's for allergies, sinus pressure, congestion, again, potentially alleviating upper respiratory infection. And you all see this on a regular basis. And this is, again, proven to be very effective in that way. And Pasha will speak to it in a minute. We have clinical data. We have someone else entering the room, so I guess we'll let them in. So we actually have clinical data. So we have 3 clinical studies that have been published to and accepted from the American Otolaryngology Association, which is a big deal. And these studies effectively really tried to show not only the first study was on the effectiveness, can it hit those regions? And then the second study was really focused on a comparative against the industry leader, targeting those regions, both positive and negative. How do we compare against that product? And as you see, it's a substantial differentiation. Again, 10 times more effective, 100% elimination of those negative side effects. And the last study, the most recent one, is really on the compliance front, but I'm going to let Kasha talk a little bit about that. But in the end, this is really what this is all about. We all know that to remove the allergens and bacteria and contamination, you've got to rinse. If people are not rinsing and they just bought the bottle and sit it on the shelf, it's obviously not doing anything. So in the end, it really is all about compliance. And this product is going to go a long way in improving that compliance. There's a lot of these people out there, but we've had, just industry-leading providers and centers that have adopted this product. And again, we received just tremendous feedback, which really makes us happy. This is really all about trying to listen to the market, being very receptive about what they want, what they don't want, and then really designing in around and relative to that. From a patient standpoint, we've heard, great. If you look at this, best product ever, crazy, wow, love this product, no drowning, amazing. Again, so these are just like our beta group. These are people who are representative of the overall market, from people who are maybe, chronic to seasonal to acute, episodic, situations. These are people who have used every device that exists on the market. They've all said the same thing. This is unlike anything we've ever seen before. Again, great feedback and very exciting for us. This is a great slide because, working with doctors are easier said than done. Sorry, doctors, okay? And so, they tend to be, as they should, right? They tend to be very, very critical. Why? Because they're trying to provide the best care. They're trying to maximize health outcomes, right? And so, having been in this, industry for greater than 25 years, selling to doctors and clinics is really difficult because they get pitched all the time. They're focusing on trying to deliver care. Everyone's got something that they want to sell them, right? And so to get feedback is really, really difficult. Many of these quotes are from people who have never quoted ever before and allowed anybody to quote them, and have allowed us to quote. So, Ralph at Duke University, who heads up the ear, nose, and throat center there, I think is a great example. So, he was actually one of the most critical at the beginning, where he kept asking, more clinical data, more clinical data, more clinical data. And we satisfied him, right? It was a legit request. But finally, we sat with him, we had coffee, we gave him the device. We said, Ralph, why don't you just use it? And sure enough, he went and used it. He came back and he said, you can use this quote. He said, but I actually tried 4 times to drown myself and I couldn't do it. He said, you need to put all over your marketing and promotional material. You completely eliminated drowning. And that was a big deal for him because he knows that's a huge impedance from a compliance standpoint. Dr. Dale Rice, industry giant, that everybody truly kind of listens to, and he has totally embraced this product. He used it as one of the most impressive things that he's ever seen. He's actually the one, quite frankly, that encouraged us to go head to head with the market leader because he was so confident in our ability to outperform. And then this is our website. And so let me do this. Let me end this share right now. Again, I just wanted to kind of walk through some background, but I really want to focus on the product right now. So can you now see me? Yeah? Okay, good. All right. So let's do this. I'm going to walk you through the product. So I'm going to give you a lot of the narrative. So the backdrop of what we've been trying to do from end to end, and I hope you're going to see this as we go, is we're all about the customer experience. From the design of the product, to the design of the packaging, to the instructions, to the website. And what we're really trying to take into consideration is, what do they want? What don't they want, right? And so unlike, and again, I'm not going to name them, but if you look at a lot of the nasal irrigation products, and you look at the packaging, it's very loud, very obnoxious. It's just not very appealing, to be quite honest, right? And so when we designed the box, we tried to make it so it's very, very simple, very intuitive, very clean. It actually feels like an Apple box. It's just easy on the eyes to look at. It actually is more like a beauty product than a health product, right? And that was very intentional. When you open up the box, again, this is a nasal rinse kit. You get a nice presentation. In here is the actual nasal rinse packets themselves, and we'll talk about those in a minute. You have the bottle that sits here with a nice presentation, and then inside is the actual instructions. Again, very, very simple. But let's start really focusing on the bottle. So the first thing I'm going to do is I'm going to hold up, and I actually covered up the name. I'm not trying to reveal what they are. But there's a key observation to make here. And this is true. I could hold up 10 different products, and they would all look the same. Forget the bottle, because the bottle is very different, right? But the bottle only holds the fluid. The bottle isn't where the magic exists. You got to look at the nozzle. What do you notice? They're short, straight up, stubby, with a straight hole. And there's a very negative implication of that. Again, ours anatomically designed. We're going to get to that in a minute. But let's talk about the overall experience. So when you rinse with any of these, what's going to happen is you're going to actually, because it's short, because it's straight up with a single hole, it's actually going to block your nose. You can already hear my voice change. So I can already feel pressure starting to build. I haven't even squeezed it yet, right? So pressure is building. And if you look at any of the videos for the product, they all do this. They show it rinsing and it's coming out the other side of the nose. There's 2 fundamental problems with that. So first of all, when you squeeze, because it's short, it's hitting the inferior turbinate, that first anatomical nub, and it's going to the back of the throat. The only way the rinse gets out your other nose, it's not going through your elbow, right? It's going through the back of the throat. And as soon as it hits the back of the throat, that is where drowning sensation and ear discomfort happens, and then it comes out, right? So that's a big negative. Most importantly, though, let's step way, way back. Why do you rinse? You rinse because you're trying to reduce the amount of allergens, bacteria, contaminants, viruses. I think we all are more educated on viruses than we ever wanted to be, right? You don't want, whether it's it's a seasonal allergy, whether it's an environmental allergen, whether it's a virus. You don't want those in your body. You want to rinse those out. So let's think about this. Let's revisit this. If it's coming out your other nostril, we don't live in a world of symmetry, right? If you have bacterial infection or virus infection on one side, I can assure you it's not perfectly symmetrical on both sides. So when you're rinsing and it's coming out the other side, if that wasn't infected before, it certainly is now, because you're pushing it all out to the other side. So you're literally producing cross-contamination. And again, you're pushing it back into your body. The only way it gets, quote unquote, out is going first into your body, to your back of your throat. Some of it's going to drop down. Again, you can't defy physics, right? Gravity is pulling that down. So now you've actually brought those allergens further into your body. That's a huge negative, right? Again, it's short, right? And so when you're trying to rinse your nose, you're actually trying to get away from that middle septum. That's not a target area for a favorable outcome. You're actually trying to get into the lateral walls, the far right and the far left, up and back into the maxillary areas of your sinus environment, right? You can't do this with this, right? So if I say squeeze it and you want it to go up and to the right or up and to the left, you can't do that. You can't defy physics. It's just shooting straight. And because it's short, it's hitting that inferior turbinate and going right to the back of the throat to a large extent. So let's compare that to this design. And again, for those of you who are doctors, and you think about your surgery in the nose, you know your instruments are not straight. They're anatomically designed. In fact, they're anatomically designed like this for a reason, right? And so our nozzle is anatomically designed. There's a few unique characteristics. First of all, it's thin, right? And that the thinness allows you to actually easily put it into your nasal cavity, okay? So you put it in. It's very gentle. It actually creates an opening for the rinse to actually flow back out. It's actually tapered here a little bit, so it actually gently opens up any kind of, if you have a deviated septum, it'll slowly open that up. The length allows you to actually bypass the inferior turbinate. Remember, the problem here with any of these is it's hitting the inferior turbinate. It's actually impeding the flow. This is not being impeded at all because it's actually bypassing the inferior turbinate. Additionally, if you can imagine, how do you get up into the higher sinus regions? How do you make fluid curve up, over, and back? You can't do that. But this can, because it's already anatomically designed to reach into the higher sinus areas. The other thing that's very unique is it actually has this turning capability. See, this is a control knob. And what this allows you to do is actually have full control. Here, you don't have any control. You spray and spray. You spray and pray, right? Here, you have full control. So in this case, you can turn it so that when you rinse, it's directing the fluid away from the middle septum to the far lateral wall and up and back. You rotate it. You now direct it to the far outer wall of your left nasal cavity, up and back to the higher sinus region. So again, unlike the other products, this gives you full control. The other thing that's unique here, again, remember when I'm putting it in here, is when I rinse, it actually comes out the exact same side. That's huge. Remember, we revisit. We don't want to push it into our body. We don't want to put it to the back of the throat. We don't want to cross-contaminate. But when we rinse, we want it to come out the exact same side. We want to maximize where it goes in the nasal environment. We want to provide directional control, so we direct it to the lateral wall and away from the middle septum, whether it's right or left. It's not a right and left. It's a right or left. And this gives that full level of control. So that's kind of the device itself. Let's kind of open this up a little bit, right? So I'm going to open up the top here. And I'm gonna throw Kasha on the stage here in a minute. So I'm gonna first throw him under the bus a little bit. So this is the rinse packet. And so as I mentioned before, we really tried to think all the way through the overall patient experience. And so for those of you who have rinsed before, even this salt, the saline rinse packet, can sometimes be intense when you rinse. It feels strong, it stings, beyond just the device giving you a negative experience, the rinse packet does as well. And so we've actually created a unique formulation that's buffered that was intended to literally eliminate any of the kind of intensity or the stinging effect of the rinse. And we did such a good job is we actually have people telling us it's the best rinse mix they've ever had before. So we've really, again, from beginning to end, we've really tried to do everything we can. But imagine now opening this up and then putting it into this tiny little hole, right? I mean, this is a little hole. If you look at the holes, they're tiny. If you look at our hole, it's actually large, right? And so I love this story where Kashyap is a surgeon. His wife would laugh at him. So before our product came to be, he was using all these other products. And he would try to put the salt in, it would actually spill over the place. And she would ask him, like, how can you possibly be a surgeon when you can't put salt into the bottle, right? And it actually makes sense. But also from a cleaning standpoint, you can imagine how difficult it is to get cleaning instrumentation into, and they're exactly the same, a narrow bottle. Ours is designed intentionally like a baby bottle. So it's wide open. It's very easy to pour the salt in, right? You can drop the whole salt all the way in, and you can certainly clean it very, very easily. The other thing you'll notice just at the very end is that it's also ergonomically designed, right? So it has this nice little curvature to it. It's not to say that these are tough to hold, but we've had a lot of feedback to say these are easy to hold, right? So I guess you could run a triathlon and rinse at the same time, which is actually great, right? So we've actually tried to, all the way through, create a positive experience. The last thing I'll say is really from an instruction standpoint. So again, I'm going to try not to show the name, but this is a real pamphlet that comes with one of the other devices. It's actually 32 pages long. It's really complex. I would challenge you to quickly find the instructions of even how to use, right? We try to take it to a new level. So our instructions are actually one page, very simple. One just shows kind of the differentiation and the effectiveness. And the other one is just 3 simple steps, and then you're off you go, right? And so again, from the packaging to the product to the rinse to the instructions, we've really tried to create an optimal experience for the patient, for the doctors, and I think we've really done a great job. We're never going to be perfect. We're always trying to listen to feedback and seeing what we can improve, but we do feel very confidently that we have a superior product as it relates to, again, irrigation, but ultimately for drug delivery as well overall, which is really going to make a big impact in global health. So what I'd like to do is hand this over to Kashyap. Kashyap, maybe 3 things. Just speak to, as someone who runs a clinic like he, what are you hearing from patients relative to what you've heard before? What are you seeing from a compliance standpoint? And then ultimately, because you're, again, unsolicited, you're getting texts from, leading doctors, what are they telling you? So if you go a little bit into that.
Yeah, so I have allergies myself, and once I moved to North Carolina, my allergic rhinitis were off the roof. That's when I realized how difficult and what patients actually meant when they said they're drowning. So I trained in Los Angeles, Keith, so that where you were, that's my hood. So I know exactly how the Skid Row and all those areas are. But I would say, hey, just use it. Just use it. Don't complain. Yes, it does. It causes your discomfort. Yes, you have a drowning sensation, but just keep using this. And so once I started using it myself, I realized, man, this is not good. And you kind of understand and empathize what they mean by ear discomfort, what they actually mean by drowning. And so that was the whole starting point of, hey, there has to be a better way of doing this thing. And that's the reason we see in our post-op patients. They don't want to rinse and then we see them in the post-op and they have crusting, and then we are going in and taking those crusts out, and our outcomes are not as good. The patient is unhappy because we have to take those crusts out, and it hurts them, it bleeds, and the room next door, the patient next door is scared because he's hearing them voices. He's like, hey, what the hell is going on in the other room? So we all, as physicians, we know the importance of rinsing. It's just that we have not been able to either come up with a better solution or convince the patient and do it on a regular basis. And I don't blame the patient because, for those of you who have not rinsed, please rinse. Rinse with any of the devices and then rinse with us. Me and Don always say this is like a Coke Pepsi challenge. And once you rinse with both the devices, you will know the difference right away, what we mean by that. And so ear discomfort and drowning, two most common complaints that patients will always call us. They say, look, hey, I'm having this problem, I can't do it. Or, hey, I'm drowning, I don't like it. And so that was the reason behind us to say, look, we got to improve the compliance. But also, from a scientific aspect, we knew that the role of sinus surgery is not to cure the disease. The role of sinus surgery is to take the disease process out, open up the passageways, and then deliver the medicines to your sinuses. But if the if the medications can't get there, then if you're not giving the best outcome to the patient, and if they're not seeing the outcome, the patient is not going to rinse with the medicated rinse. And they're not going to rinse the medicated rinse, your outcome is going to be bad. So it's kind of a cycle that you got to break. What we saw, at least once we started with our clinic, was that, hey, it does not cause any drama. It does not cause any ear discomfort. In terms of our compliance, we just presented a poster at the academy where we are showing 88% compliance in just 4 weeks in allergic rhinitis patients with their daily rinsing. And it's unheard of. Medical compliance, we all know, and we people who are practicing know, less than 50% of the patients do daily rinsing. And especially if non-operative patients, allergic, as complex as allergic rhinitis is, they don't daily rinsing. So we've seen an increase in compliance. I'll share with a few codes, and then people have given their permission to me to share. Like Dr. Roy Casiano in Florida, his nurse, Anna Beater, she said we used to get 6 to 8 calls every day from patients who are doing rinsing about ear discomfort, about hey, this is the water is getting in my ears. I'm drowning. And she said after we've switched to your device, she's getting 0 calls. So that's a huge time saving on the staff that she can focus on something else. Ralph Abihashim at Duke, he's actually putting together about a case series about patients who with frontal sinus disease who would have needed draft 3 procedure. She started them on medicated rinse using our device. In about 4 weeks post treatment, the frontal sinus disease is gone. They don't even need a draft 3. And it's a case series he's putting together, but he's already has 3 patients that he has 3 and few other physicians have 3. David Jang, he said the same thing. And so they're all saying like, hey, I don't think the frontal sinus, we have to be that aggressive with the frontal sinus disease with this device. Now that we can just open it up and deliver the medications there. Dr. Stil Kuntakis at Georgia, I mean, at Louisiana, he stood up and he said, you guys don't know what you're sitting on. You have the potential to revolutionize frontal sinus care. And he was the first one to point it out, hey, you can get rid of draft 3 because patients fail because we can deliver the steroids up there on a continuous basis. In terms of compliance, like Ralph always texts me when his patients come back and give him feedback. He's like one of the patients, she's a PhD, and she comes back and said, hey, why have you been giving me other devices all these years? Why didn't you give me this device? And she actually made it a point to tell to all staff that, hey, don't give your patients other devices. They have them recommend this device. So these are the things that we are seeing from physicians. Is it the perfect device? No, but I can tell you from my personal experience, and as I said, look, do the Coke Pepsi challenge. And I told when Anna herself is an allergy patient, and I said, hey Anna, if you have the drowning sensation, come to Raleigh and throw the bottle on my face and tell me I had a drowning sensation. And she called, and they work with Advanced RX. She immediately, as the compounding pharmacy, she immediately emailed Advanced RX and said, look, Jason, I need all my patients on this device. This is the best device we have. So we are seeing, I think from our perspective as physicians, we need patients to be rinsing. And if we can improve their compliance, and the only way to improve their compliance is to reduce their side effects. And if they start doing the rinsing, they'll see a better outcome. They'll be more compliant, and they being more compliant, we'll see better outcomes. And I think that it helps everybody in the whole process.
Absolutely, Asha. So thank you both so much. I did have a couple of follow-up questions, and you probably have some from the audience. So most of our attendees today are the administrators of these all-star practices around the country. And so they'll take this information back to their physicians. Can you distinguish, you mentioned something that's very important for what you and I do on a daily basis, medicated rinses, where we apply steroids and antifungals and antibiotics. Can you comment so they can relate to their doctors, whether that is a prescription, whether that is on label with the FDA, et cetera? I just wanted you to clarify.
The way it works is with the compounding pharmacy, the physician has to tell, hey, I want X, Y, and Z medication, and I want X, Y, and Z device. And then the compounding pharmacy will get this with the medication, and we'll get the device, and then we'll send it out to the patient. In terms of FDA, we are FDA registered. We didn't need to be, but we have submitted our safety data and all that data with FDA, so our device is FDA registered. Is it FDA approved for chronic sinusitis? So currently there's nothing that's FDA approved for chronic sinusitis, but because it's a compounded drug and with a device that's FDA approved or FDA cleared and a medication that's FDA approved, the compounded medications can be done. So they can write a prescription. It's a prescription that goes to the pharmacy, and depending on which pharmacy you guys work in terms of compounding, we can work with them. We already started working with a few of them, having them on the shelf. Basically, what we want is a very smooth process for the patient, where the patient doesn't have to go 10 different places to collect stuff. We want a very smooth process where we can have the device, the medication all shipped at the same time to the patient.
Yeah. The only I want to clarify though is what Kashyap was just talking about is the medicated rinse. But this, traditionally, I'd say 90% of our business is non-medicated rinse. It's just simply the saline rinse kit, right? So, I don't want you to leave you with the impression that this is only for medicated rinse. That's just an example of where you can use the rinse product with medication to produce a medicated rinse. But again, 90% of our business is just the straight up kit. It's just a nasal rinse kit. You can resell to your clinic, to the patients, and leave with the product, but obviously increases compliance and kind of off they go.
So that's the other thing we noticed for that from the online, like from selling through our clinic. If you guys have ever been to Walgreens, Walmart, or Target pharmacy on the allergy aisle, there are about 50 to 100 products on allergy. And if you're standing there, you get confused about which product to buy. So having the product in the office, we have seen zero resistance from the patient, and they actually are very happy that they can get something while they're checking out, and something that they don't have to go an extra step. So it kind of reduces the extra step that the patient has to take to get a product on their hands.
As I mentioned at the outset of the call, some of you hadn't popped on yet, but that's what we've been doing in my office in Dallas, and same experience. Patients like the convenience factor. Don, can you comment a little bit on how most of the attendees on the call are already USDT members, or how they could access this technology?
Yeah, no, it's a great question. So, relatively straightforward process. So I would say reach out to, either through Key or directly to us, express interest in trying the product. We'd send you a couple samples. I mean, typically what we find is and again, this is where we truly encourage you to do a, Coke Pepsi challenge, right? Take one of the existing products, take our product and rinse with both, and it'll speak volumes. We'll also see the doctor generally give it to a patient or two. We send you the full kit, just so you know. So these aren't, little tiny samples. These are full kits. And the idea is to give the user the full experience of the product. And then at that point, if there's interest, you can come back to us. We give you a specialized code that gives you a unique discount that's only available through US ENT. You can order through our website. You enter in the code. That gives a discount. That connects you, from an accounting standpoint back into US ENT, so that Keith, has attribution for, what he's done in bringing folks to the table. And then, off we go. And again, you have, a great discount that's associated with it. The product is shipped to you, and then you sell it. Typically what we find, we have two bulk wholesale products where you buy and then you resell, very much like, hearing aid that you may be dealing with today, right? You buy the product at a discounted wholesale price and you resell it. So we have two bulk products. One is what we call our starter kit of 24 nasal rinse kits. What we typically find is people start with that just to see how it flows. On average, we're seeing, a clinic with one or two doctors go through about 3 or 4 per day. So you go through 24, pretty quickly. So what we typically find is you start with the 24 starter kit and you progress up. So in the case of Kashyap, again, he just placed an order for another 260. So the next one up is what we call an operational kit, where there's actually 60 kits in that particular cut. And he's going through that pretty quickly. So again, having some great success. We try to create a model where it's really simple. It's a simple email process. You log into the website, it caches your information, you enter in the code, you get a discount, it gets shipped to you, and then you just reorder whenever you need to. And it's really kind of turnkey, pretty straightforward.
Well, two things I would like to add on that one. What we have kept the process of ordering very simple, because all of us who work in healthcare, we know we have to click multiple times. So we didn't want any of those experiences. We kept it very simple, straightforward in terms of ordering. Second is, being a private practice, I look at my practice as from a business angle as well. Because we all have to, because if we don't, then we won't be able to practice the medicine that we want to kind of practice the medicine we want to. So just like how having an additional source of revenue for the practice is good, so like hearing aids, CT scans. So these are all ancillary services. Will it be the main revenue generating? No. But will it be the ancillary service? Yes. Do the patients like it? Yes. Do they get a better experience? Absolutely. So I think all in all, it helps in tying to what you guys are doing in your practice as being a kind of one-stop shop for the patient.
What do you sell them for? What's the retail price to the consumer?
Yeah, so the retail price, so whether you go on our website or Amazon, it's $30. If you go on our site, it's $32 plus a flat rate of $3 to ship, so $35. If you go on Amazon, it's $35 and free shipping, right? And so it's basically in the end $35.
It's for a 2 month supply though, keep in mind. So we have 60 salt packets, so it should run for you for at least minimum of 2 months. So it comes down to like $16 a month in terms of pricing for the patient.
Thank you, Don. Thank you, Kasha, so much for sharing with us today. It truly is another one of those beautiful inventions. It's simple, but it's such a game changer, certainly in postoperative care, but in the ongoing management of these allergy and sinus patients. So we appreciate your partnership, and thank you so much. And Julia can coordinate as far as getting your food credit, most importantly.
No food for Kasha.
And my wife is already wanting me to lose weight, so.
So none for the doctors, just for the admin. All right, thanks everybody. We'll look forward to seeing you again next month for our next Spotlight.